Dr. Doreen 𝗟𝗢𝗓 is the
Dr. Doreen is an expert in autism.
Doreen 𝗟𝗢𝗓.
Dr. 𝗟𝗢𝗓.
Dr. Doreen 𝗟𝗢𝗓.
Dr. Doreen 𝗟𝗢𝗓 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Nada says, my 5.5-year-old autistic son scored a 67 on his IQ test. This is an average of 2 tests. One scored really high and the other one was low. The test is done so that he can go to school. How reliable is an IQ test for him? And what does this IQ test mean in terms of his learning capabilities and future?
Yes, very good question.
Yeah.
So IQ stands for intelligence quotient, and the quotient, or the decimal, is your child's mental age divided by their chronological age. So for instance, for me, and then times 100. So it's the mental age divided by the chronological age times 100. So a lot of people, whatever their mental age is, let's say my mental age would be 60, and my chronological age, my actual age, is 60. So it's 60 divided by 60, which is 1, times 100. So my IQ becomes 100. 100 is normal IQ. And as like everything else, we're a population of people, so we're not all going to have an IQ of 100. Some are going to be 95, some are going to be 105, etc. And there's what we call a normal curve. That means that the vast majority of people, I think it's something like 97% of people, will fall within one standard deviation below or above the 100. That means that the vast majority of people, like 97% of people, will be, and the standard deviation for IQ is 15 points. So the vast majority of people will be between 85 and 115, okay? So that's classified as normal IQ. Now, what does it mean for our children? How do we measure mental age? That's very, very important. We measure mental age through a series of activities that are done in IQ tests. And there's lots of different IQ tests, but they all have different activities that they ask you to do. And then if you do them successfully, you pass, or you get a specific score. And if you don't do them correctly, you don't pass and you don't get a... The two, I think, that you're referring to are verbal and performance. Those are the two types of measures that take place in, let's say, the Wechsler test or some of the IQ tests. And so they go together, and then they're giving you an overall IQ. And it's important to know which one is which, right? Because the majority of the time, our children will perform poorly on verbal scales of IQ because I'm telling you something in a language that you may not understand. So for example, a very young, like an early IQ test or mental age test, the Bailey asks the child to do things like, you know, there's like a farm, and they'll say, put the pig next to the cow, just as an example. And if the child doesn't know what pig and cow are or next to is, they're going to fail at that, right? That doesn't necessarily mean that their intelligence or their abilities, their brain abilities are not all there.
Yeah.
It just means that they never learned those labels. And this becomes very, very apparent when you take very intelligent, nonverbal children who are deaf, right? Children who are hearing impaired. And you give them, or let's say as an example, there used to be years ago a lot of research that was done on socio-cultural effects of IQ, where like you would take an IQ test and give it to someone from a very, very low socioeconomic background, let's say, and they just would fail because they didn't know those specific advanced vocabulary words that were being used. And so IQ tests became a very touchy subject because think about it, if you are a child who has language difficulty, right, and I give you an IQ test, you're always going to score lower because of the language aspect, not because of the intelligence aspect, but because of the language. The only way that this becomes a little bit more valid, little bit, not 100% more valid, is if I use a nonverbal test, a test that I would use, let's say, for hearing impaired children. Becomes a little bit better. But again, a child with autism is having all kinds of sensory issues as well. distracted, the lights might be bothering them, they might have GI issues, whatever it is. Our kids are not always on their best place, right? They're not always performing at their best, and they're very, anxious in new environments with a doctor perhaps, and there's lots of factors that can interfere with the child's responsiveness on an IQ test. So therefore, in general, IQ tests are not the most valid with our kids.
And they can change.
And they can change, and they do change, obviously. And that's like one of our goals with intensive ABA is we always give an IQ test in the beginning, and we try to give children who are nonverbal IQ tests. There are a few, I've talked about this in the past, the lighter R, the Merrill-Palmer, there might be new ones now too. But these tests will measure your child's intelligence as best as possible. And then a year later, after doing intensive therapies, you want to measure it again and again. And you want to get to a point where your child's IQ score is increasing. And it correlates a lot with their increase in language, increase in comprehension, increase in ability to pay attention. As they're learning all of these things, their IQ score will also increase. So I guess it's important to think about that when you're talking about IQ, because we tend to think of our kids as intellectually disabled, whereas a lot of our kids are not intellectually disabled. They just don't have, we don't have access to measuring their pure intelligence through IQ tests.
That's right. So don't put much store in it, think of it as a baseline, and it's only, as you work, like you've got lots of room to go up, and you absolutely can.
Yeah.
This was, you wrote this and I was like, oh, this was our story. The first time they tested him, they couldn't get a score at all.
Yeah.
Said he doesn't have enough language to get a score.
Yep.
The next time we got one high score, one low score.
Yep.
And they said it's invalid because they're so far apart.
That's right.
Right?
That's right.
So, and now he has a much higher than average IQ, so don't worry, but don't lose sleep over it, don't sweat it.
Yeah.
Just make sure that you're getting good therapies and he's learning lots of good things.
And Nada, I want to go back to exactly what Shannon is saying. If one scored really high and one scored really low, and if I'm assuming correctly that you're referring to the performance and verbal portions of the IQ test, to begin with, if the score difference is over 15 points, I think, then it's not really a valid test. But for your knowledge, you always want to gain something out of these tests. And what I would suggest is if your child is doing very low on verbal, relatively high on performance, that means there's a lot of language to be taught. If it's the reverse, and your child's having an issue with performance scale, then that means that there's a lot of inattention going on. I would really ask the person who administered the test to sit with you and go over every subtest and explain to you how it was done and what it measures, because that is where you learn a lot. That's when you realize, oh, wow, he's having an issue with things that are visual memory. Oh, he's having an issue with anything that's an auditory instruction. Go through the details. I promise you, you learn a lot. And don't worry about the score. The score changes.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.